I'm used to taking care of people who are very sick. There are patients on ventilators, even in the hallways. We don't always have enough trained nurses. This is really overwhelming. At times, I feel like I can't do it anymore.
Some days are better than others. Today, I felt anxious and nervous, and I couldn't stop thinking about how sick my patients are.
Am I even making a difference? I did all I could for her, and she still died. She was alone when she died, as family are not allowed in the hospital. Now I have to call them with the tragic news.
5 patients died in my unit today. I can't believe that. I feel numb.
Compassion fatigue can happen to anyone, but the people who seem to be most at risk are those healthcare workers who care day after day for patients who are struggling with significant symptoms. Compassion fatigue is not burnout and is not simply about being overworked. It comes about from the stress of being exposed to trauma. Healthcare workers who are regularly exposed to traumatic situations through their day-to-day work treating others can overload their ability to cope and experience compassion fatigue. This experience includes both mental and physical exhaustion and can cause those that experience it to have intensive trouble coping with everyday life experiences. As a provider, empathy might be one of your most valuable skills. It's also the same trait that can make you vulnerable to the experiences of your patients. You may find yourself suddenly feeling exhausted, frustrated, or sad. Thoughts and feelings may become overwhelming, cognitive functioning can be impaired, and you might feel completely lost when you used to feel the most confident. Providers are especially vulnerable during disasters or pandemics like COVID-19. When they are working longer hours, losing more patients than usual, supporting patients through tough emotional responses to the crisis, and generally working in a more stressful environment, providers can protect themselves and build resilience by keeping a few simple things in mind. Be with other professionals. Social support among colleagues is a protective factor for providers. It allows you to feel connected with peers, as well as seek consultation or even just the chance to vent. Isolation is a risk factor and a warning sign for compassion fatigue, and staying connected with others reduces its likelihood and severity. Choose optimism. An optimistic outlook is protective against compassion fatigue, as well as many stress-related health consequences. One exercise that promotes optimism is writing a gratitude log. Once a day, write down 3 things to be grateful for. It works. Make time for self-care. In a busy office, clinic, or hospital, you may only have 5 free minutes at a time. Use those minutes wisely to care for yourself. Everyone's favorite activities are different. You might feel best when you listen to music, journal, meditate for a few minutes, pray, or read. Any of these and others can protect you from the effects of difficult work. Compassion fatigue is a risk for any medical or mental health provider and affects the ability to provide outstanding care to your patients. Providers can help protect against the effects of this experience by putting a few simple practices in their day-to-day routine. Your work is so important, and so are you. Self-care isn't selfish, it's just good practice.